Welcome to the Exam Room Podcast, brought to you by the Physicians Committee. Hi, I'm the weight loss champion, Chuck Carroll, at the International Conference on Nutrition and Medicine 2022, and I'm sitting across one of my new favorite people of all time, Dr. Gemma Newman. Good to see you.
Good to see you, Chuck Carroll. Thank you for having me.
You know it's my pleasure. Come on now. We hit it off so well when you were on the show just a couple of weeks before you came to the conference. I said, my goodness gracious, if there's one person I need to do the double dip with, it is you.
Oh, well, thank you.
Yeah.
That's very kind.
We got a lot of feedback from your interview. Lots of positive feedback. And
Great.
I want to kind of continue the conversation. We were talking about a lot of things before, but I want to center in and really do a hyper focus on period pain. Again, as a guy, not something that us fellas know a whole heck of a lot with, but as I was saying right before we roll tape, you know, I have a whole lot of sympathy and just I want to, like, I feel for women. Like, I had no idea, you know, most guys don't.
No.
And so I love to continue this conversation here, right?
Well, thank you, Chuck. And I love that you love that because it's crucial for so many different relationships for men to know more about the lives of women and what we go through. So thank you so much.
I'm just saying, like, as a guy, if I were to get kicked in the groin once a month, I wouldn't enjoy that, right?
No, I should think that you wouldn't.
No.
No.
And I'm not comparing the two, but if you know that that's coming regularly once a month, that's not something you're going to be looking forward to. You're going to dread it. And that's very much a reality for so many women.
Yeah, you're so right. And periods can come and they can be fine. You can have a few days of bleeding without pain, or you could be in a situation where you get those nasty cramps, you get really bad heavy clotting, you have to use lots of pads or tampons, you get diarrhea or nausea or vomiting with it sometimes, bloating. So it's not fun. And I want to just emphasize that many women get period pains, but if you're getting extreme period pain with heavy clotting and, you know, having to take days off work, that's not normal, and you should get some investigations just in case there's something else going on. I know we talked about and touched slightly on endometriosis and fibroids and perhaps PCOS, I can't remember now, but yeah, I think it's important to go and see your doctor first off because there's a lot that you can look at, a lot that you can diagnose. And if it is primary dysmenorrhea, which basically just means standard period pain, then there are also things you can do, not just with medications, but with lifestyle as well, which is fantastic.
Right. So what are some of the common causes of this? You know, you just said some women are able to breeze through it, no big deal. Other women having severe issues. What's the difference there between the two? What might be triggering that?
Well, I mean, there's lots of kinds of potential reasons, but lifestyle can play a part. You know, in the normal menstrual cycle, we have a real sort of symphony of different hormones all coming in at different times to trigger ovulation, to trigger thickening of the womb lining, to trigger release of the womb lining if there's no pregnancy. And this kind of hormone symphony has to work well, right?
Right.
And if you've got too much estrogen, then you have too much of a buildup of the womb lining. And then, of course, then you got more to bleed out once a month. And if you have that thicker womb lining, you may also be producing more prostaglandins because that's produced at the womb lining itself. And these prostaglandins can cause contraction of the womb, and they can also cause a lot of pain. And when they get into the bloodstream, that's when you would get potential diarrhea or nausea or vomiting as well. So if you can reduce the amount of excess estrogen that you're exposed to, or reduce the amount of excess progesterone that your womb lining is producing, then you can reduce the amount of period pains that you experience. And there's a number of ways to do that. Doctors would usually suggest medications, of course. Naturally. And the combined oral contraceptive pill is really effective because it reduces the amount of prostaglandins that are released by those womb lining cells.
Yeah.
Same with anti-inflammatory painkillers. They work in the very same way. I don't know what your trade name drugs are for anti-inflammatory painkillers, but in the UK, we'd know them as ibuprofen, or maybe naproxen, mefenamic acid, tranexamic acid. They all work in the same way. They reduce the amount of prostaglandins released at the womb lining. So that's great news, but there are also ways to do that through your diet, which I can come on to if you want to.
Yeah, so when you say ibuprofen, to me, the first thing that pops into my mind is anti-inflammatory. So if you're eating a really high-fat inflammatory diet, is that part of the issue here?
Potentially, yes, but they also block prostaglandin production, and so that's how they work in this instance.
I see. That's why you're the doctor. Yeah. So yeah. All right. So let's dig a little bit deeper then. All right. So
basically, as you may have guessed, a high fiber diet is great for reducing period pains. Now, you might not know why.
I have no idea, to be honest with you.
Okay, well, I'll tell you why. When you have a high fiber diet, one of the many advantages is that you don't get constipated, right?
This is true.
You don't get bunged up.
Firsthand, yeah.
Yeah. And when a woman gets constipated, or when anyone gets constipated, what they'll do is they'll recycle unwanted hormones through their system that their body has been trying to poop out, because the body has a good mechanism of getting rid of hormones that have once been produced, no longer needed. They poop them out. But if you're constipated, you're not going to poop out as many of the hormones, and you're going to have more of an exposure to them in your body.
It literally basically reabsorbs into the system.
It literally reabsorbs.
That's not pleasant.
No. So that's one way that a high-fiber, plant-rich diet can really help with period pains.
Yeah.
Another way is by increasing something called sex hormone binding globulin, or SHBG. And that's like, it's basically a protein carrier molecule which has got a really great function. It takes unwanted hormones, or hormones that you're not ready to use, or hormones that your body doesn't actually need right now, and kind of stores them for you to use later.
Right.
So when you've got high SHBG levels, it means that you're not exposed to excess hormones. Interestingly, women who have polycystic ovarian syndrome have lower levels of SHBG, which means that their bodies are much more exposed to the hormones they're producing, and they may then be more likely to experience things like period pains as well.
So let's talk about some remedies then, Dr. Newman. So a lot of people, I say, well, they turn to herbs for a lot of different things. Are there any in this case that might be beneficial?
Well, actually, there are. Interestingly, there have been some studies to show that things like ginger and turmeric, cinnamon as well, has been actually shown to be beneficial for period pains. In fact, there was one study where they used ginger and they dosed that, I think it was about 250 milligrams in a capsule 3 times a day for 3 days during the heaviest days of the period.
Right.
And they compared that to ibuprofen, 400 milligrams 3 times a day, and mefenamic acid, 250 milligrams 3 times a day. So the standard doses that you'd take of anti-inflammatory painkillers. And it was equally as effective as each of those anti-inflammatory painkillers to help mitigate the effects of period pains.
Shut the front door. Cinnamon.
That was ginger.
And ginger, right. Yeah.
But the cinnamon study was done on Iranian students.
Okay.
I think there's about 76 students involved in the study. They were given cinnamon pills and placebo. And what they discovered was that those who took the active cinnamon compounds had reduced period pains as well.
Oh, wow.
Yeah.
Okay.
So vitamin D. This is another really curious one. Most people know that vitamin D is... Well, actually, it's a hormone, not a vitamin. That's an interesting little factoid.
There's your fact of the day, roomies.
But interestingly, vitamin D has many receptors on the womb itself. So we know that most people know that you can actually make the hormone vitamin D through sunlight exposure to your skin.
Right.
But there are receptors for vitamin D in the womb. And there was a study that showed a single high-dose vitamin D supplement for those who had a deficiency improved period pain as well. Magnesium is another one that has been found to reduce period pain. So it's really interesting because if you're of a mind to use herbs and spices in your day-to-day diet, that's great. You can add them into your cooking. But also, if you want to try them as a sort of an active alternative to anti-inflammatory pain relief without the risk of gastrointestinal disturbances or GI bleeds in a worst-case scenario, then you can try things like turmeric, ginger, cinnamon, magnesium, vitamin D, and see if it does something for you. And, you know, as long as you're taking safe amounts, there's no reason not to.
Yeah, and you just said, you know, gastrointestinal issues, and it kind of made me think, well, what's a primary source of vitamin D here in the States? Everybody goes right to the milk, right? Calcium and vitamin D. So when we're talking about female health and period pain and things like that, what did the study show? Is there a connection there that you're familiar with? Has there been any research on dairy's effect?
No, so I don't know of any effect solidly on dairy and period pains, although I should imagine that given that dairy does have hormones within it,
Yeah.
that there may be an excess estrogen component potentially.
Yeah.
But to my knowledge, there's no studies on that.
The patients whom you may have worked with, even people that you've interacted with in your life, and you've kind of explained a lot of this to them, have you seen some successes firsthand? Like,
Absolutely.
this is great.
Yeah, it's amazing. And it's one of those areas that has been so under-researched but so vital for so many women's well-being. It's amazing. I've seen patients not only improve their period pain, but also in some cases reduce the size of their fibroids, improve their symptoms of endometriosis. I've had women massively improve their symptoms of perimenopause, hot flashes, night sweats, sort of mood issues, anxiety. It's wonderful to see. And obviously it's not necessarily a panacea. It's not going to fix everything. But for those for whom it has made a difference, it's been really life-changing for them.
I would imagine so. I mean, it's one major less thing to deal with, I think, and such a significant thing. I mean, we started this interview talking about the dread that comes with this every month. Like, who wants to go through that every single month?
Well, I can speak from previous experience. I didn't. And actually, I will share a personal story now. You've made me feel so comfortable.
That's
I think I suffered terribly with period pains, especially during my teenage years.
Aha. I wondered if this was a personal thing for you, because you are very passionate when you speak about this. Yeah.
Well, I'm very passionate about a lot of things, Chuck, but yes, it's true. I did used to get really bad period pains, especially in my teens, and many young girls do. It's a nasty time where your body is trying to get used to all these hormones rushing through, and I used to leak through my pads. I used to have to miss some time off school with terrible cramps. I used to get these awful dragging pains in my legs and my lower back, and having to do that every month is not fun for a 12-year-old girl. Can you imagine?
You were 12.
Yeah.
Daggone.
Oh, yeah.
I cannot imagine whatsoever.
Yeah. And many young girls start their periods earlier and earlier these days. It's not uncommon for girls to start their periods 11 years of age, even younger in some cases.
Wow. You can't handle day-to-day life a lot of times at 12, and then you throw something that's so adult on top of that. Like, how in the world do you wrap your little mind around that, right?
I know. It's a big psychological adjustment for young girls. And so I think especially for preteens and teens, it's vital to get this information out there to help them. Many young girls will naturally resort to taking an oral contraceptive, which I don't have anything against, by the way. I think it can be a really helpful tool for many people. But if they don't want to do that, then there are other things that they can also do that could potentially benefit. And I wish I'd known this when I was 12 years old.
I bet. Things would be quite different. But you know what? You're here today, and you may be talking to a 12-year-old today and changing their life, right?
I hope so.
Yeah.
There's only 12-year-olds listening.
I mean, you never know. Maybe their mom is. I don't know.
Or their dad. This is the beauty of a conversation with someone like yourself.
That's right. Now, fellas, listen, it's okay to talk about these things. You don't have to be shy. I went from covering the NFL, covering sports, for goodness sakes, to having conversations with Dr. Gemma Newman about this. And it's okay, guys. Drop the macho persona. It's okay.
It's okay. And it makes you more of a man.
You're daggone right. The modern male. Let's all be modern men together, shall we? I'm so glad that you're here. You're a lot of fun to talk to.
Ditto.
All right. We'll do it again sometime.
I hope so.
Dr. Gemma Newman, thank you so much.
Thank you.
If your health IQ is a couple of points higher than it was a few minutes ago, go ahead and like this video or subscribe to the YouTube channel. And to take it even higher, head over to Apple Podcast or wherever you get your favorite shows. Look for The Exam Room by the Physicians Committee. Hit the subscribe button there as well and help to make your world a healthier place.